Hello, my name is Farm Dr. Oziome Zofo, and today is World Autism Awareness Day. Today, A.U.T.I.S.M Empowerment Initiative is here to talk about what exactly autism is, what the symptoms are, how they can be identified or diagnosed, and how an autistic child can be helped, especially by their families and the people who live around them. Now, what exactly is autism? Autism is a developmental disorder that impairs the ability to communicate and interact. It is called autism spectrum disorders because it's a broad range of conditions that is characterized by challenges with social skills, repetitive behaviors, speech, and non-verbal communication. Now imagine if you had a bee buzzing around your head and someone asked you to say the alphabets backwards. Imagine if you were in the middle of a really loud rock concert and someone wanted you to name all your aunts and uncles. Imagine if you were wearing 3 pairs of gloves and someone wanted you to eat a box of peanuts one by one. This is what things are for an autistic child a lot of the time. Now, speaking from the perspective of an autistic, I am autistic. Your brain is like the inside of a computer, full of wires and connections buzzing around telling your body what to do. My brain looks the same as yours, except some connections work really well and some work really differently. And my brain wires can get crossed really easily. So if I'm doing something over and over, just ask me to stop repeating. It's just one of my wires plugged into the wrong socket. And if I freak out at some sound that you think is really normal, maybe just help me get away from that sound. It's just that my ears have their own unique volume control. And if you think I'm ignoring you, I'm not. I'm probably just focused on something else, like a tiny spider on the ceiling on the other side of the room. Autism is just a unique way, a different way of seeing the world. And seeing things the way I see them is really awesome, but it makes me really tired sometimes. So I might not always understand what's going on, and I might need time to myself to think things through. And I might crash or jump or swing for a while just to straighten myself out. Don't worry if I don't always do things the way you do. Try to imagine what things are like inside my head. Then you'll see I'm not being rude, I'm not being naughty, I'm not sick, I'm autistic, and I'm just being me.
The characteristics of autism spectrum disorder fall into 2 categories. The first one is social interaction and communication problems. Now, some autistic patients have difficulty in engaging in normal back and forth conversation. Some of them have reduced sharing of interest or emotions. Some have challenges in understanding or responding to social cues such as eye contact and facial expression. Others could have difficulty in developing or maintaining or understanding relationships, such as having trouble making friends. And then we have other examples under this category. The second category is restricted and repetitive patterns of behaviors, interest, or activity. The first example is hand flapping and tool walking. Some kids could play with toys in an uncommon way, such as lining up cars or flipping objects. Some speak in a unique way, such as using odd patterns or pitches in speaking or scripting from a favorite show or movie. We have some that have significant need for a predictable routine or structure. They always want their things to be done in a certain way, at a certain time, in a certain manner. They don't want any change in their routine whatsoever. And then some exhibit intense interest in activities that are uncommon for children that are of similar age. Some other people have experienced sensory aspects of the world in an unusual or extreme way, such as indifference. They have indifference to pain or temperature. They indulge in excessive smelling of or touching of objects. They are fascinated with light and movement. Some are overwhelmed with loud noises, and other examples. Now, while so many people with autism may have normal intelligence, there are so many other people that might have mild or significant intellectual delay. Additionally, people with ASD are at greater risk of some medical conditions such as sleep problems. You have those that are fascinated with light and movement. So this kind of people could actually have sleep problems, because um, any ray of light or any atom of light could distract their sleep. You have some with seizures, and you have some with mental illnesses. Now, the examples I've given to you are just few examples of the symptoms an individual with autism may experience. Any individual could have some or all or none of these symptoms. Now, keeping in mind that having these symptoms does not necessarily mean that a person has autism. The only way you can confirm that someone has autism is by visiting a qualified medical professional to diagnose this problem. Do not diagnose on your own. Thank you.
Okay, straight up into the risk factors or causes of autism spectrum disorder. We have really done very well in trying to understand this disease condition. As we know, it's more common in children. They are usually diagnosed mainly in children. But now we are going to be looking at the risk factors, or what could actually predispose, a lot of persons to having this condition, this disorder rather. We have done our search, and we have been able to see that the major causes of ASD in a short form, that is autism spectrum disorder, is not well known. Okay. However, there's been a lot of information put together to help us understand what could these risk factors, or what could possibly cause this condition in these children. Right now, I want to say that many times in the clinic, you meet mothers who would usually come with this question: what is the cause of autism in my child? Why am I giving birth to a child that is having this problem? Am I the major factor? Am I the cause of this situation? What happened to the pregnancy? Didn't I take care of the pregnancy very well? What is wrong with me? Am I the cause and all of that? Doctor, what would have caused this? This is some of the questions we've been able to filter that many parents usually share, when they come to see a doctor. But with this particular note, we'll be able to, help us get a clarity of what could actually cause this. One of the major problems with autism is that it's a genetic problem. Okay, so what I mean by genetic problem, I mean that many times when a lot of genes that regulate a lot of processes in the body go wrong in their production or in their function, it will usually come down to this challenge in these children. Abnormal gene has been found to contribute a lot to increasing the risks of having an autistic child. Also, other genetic problems like chromosomal abnormality have been found to increase the risks of having an autistic child. Conditions like Fragile X syndrome, conditions like tuberous sclerosis have been found to contribute very high, in high risks, increase the risks of having an autistic child. Again, what could actually be a risk factor to having an autistic child? Secondly is it has also been found that children born to family where siblings are said to have this condition are at a very high risk of developing autism. So parents should really note that and do what is needful, as we will be seeing later. Thirdly, here is the fact that research is also being put together, and we have been able to see that that some of the drugs that parents are being exposed to during the pregnancy contribute a lot to having a high risk of autism in this family. Drugs like sodium valproate and anti-epileptic drugs that are usually used by parents, more than precisely, who have this condition, that is seizure disorders. After using this drug, they can go a long way to affect these children in the womb and cause more problem for them. Other drugs are thalidomide. Even though at this point it has been banned, but then we still found that some people still use this drug in some rural area rather, to treat one or two things that may be wrong in pregnancy, and this has been found to contribute high yield to development of autism in children. Now, to make it very easy for every parent out there with a child with autism, the things to look out for have been broadly divided into two categories. One of them are you watch out for problems that are associated with communication and social interaction, and also you watch out for repeated or restricted pattern of behavior or activities in these children. Now, let's take it step by step. And what do I mean by watching out for problems with communication and social interaction? You often find out that in these children, they find it very difficult to communicate their feelings, such as they can't share their interest with you. They find it very difficult to sustain conversation as much as possible. They also find it very difficult to maintain eye contact, okay? And oftentimes, so when you check them in their older age, it's also difficult for them to sustain relationship, and sometimes you begin to wonder what is the problem. But this is actually how these symptoms manifest in these children or persons. So to get that clear, you have to be or have a high level of suspicion for you to pick that and know that this child is actually having or suffering from an autistic disorder. And then when you check down the restricted or repetitive pattern of behavior or activities, you often find that these children are unique in the sense that they most often would want to repeat things. They keep repeating a motion or keep repeating a movement or even keep repeating an action, okay? So these are some of the things. Most times when you see these children, you ask them to stop this, you see them going back, being people will describe it as being stubborn. They go back to those things. As you say, stop this, they still go back to those things. Stop this, this is going to injure you, they still go back to it and keep doing it. So some of these things these are some of the things that are exhibited in these children. They are also found to have fixed interest and preoccupation. So they just want to do what is in their hearts or what they deem right, fit at that point in time. So these are some of the things you will look out for, and then you could say, this child has an autism spectrum disorder. So among many of the symptoms and signs that these children present with, if you are able to collect this information and then put them together, okay, with some selections as the case may be, you will be able to make that diagnosis or know that this child really have autism. Okay, as we'll see later in this discourse, we will know what can be done about this once you are able to reach a diagnosis as early as possible. Thank you. Okay, so lastly on this section is to find out how to make diagnosis. How can I know that my child is presenting with autistic symptoms, and what can I do? Right. So this is the last session on this. This is the last part on this section. How do I know my child is going through or my child is having, autistic features? Now, I want to say clearly that you do not need a biomedical test or biolaboratory test for you to make a diagnosis or to know that your child have an autistic challenge or have an autistic condition, all you need to know is that this diagnosis is made by observation. So by the time you observe your child closely, you should be able to see, because many times these children will be different from other siblings or other children of their age, right? So close observation is highly to making a diagnosis of autistic or autism spectrum disorder. Now, it's worthy of note that the diagnosis can be made as early as 18 months of age or even 2 years of age. This has been found to be, making a diagnosis at this period has been found to be acceptable. Okay, what are these features? They are very glaring and clear. We started earlier by saying that this is a behavioral defect. This usually manifests as a behavioral challenge, okay? So what are these challenges? What should we look out for when you watch your child grow?
Here are some tips for the parents. Learn as much as possible about the autism spectrum disorder. It's always a good idea to know as much as you can about your child's condition so you can better understand and interact with them. Secondly, provide a consistent structure and routine. This makes the environment more efficient and more predictable for the child, which helps them feel safer. Connect with other parents of children with autism and seek professional help for specific concerns. At times, some behaviors are specific to an individual and professional help is advisable in such situations. And finally, take time for yourself and for other members of the family. Having a child with autism affects the whole family. It can be stressful, can be time consuming and expensive. Therefore, it is crucial to pay attention to the health, both emotional and physical health of the entire family.
Treatment and management of autism. While children are not typically cured, nor do they outgrow autism, studies have shown that early diagnosis and treatment can help improve symptoms. These treatments include 1. Applied behavioral analysis, 2. Speech therapy, 3. Physical therapy, 4. Occupational therapy, 5. Medications. Let's start with the first one, applied behavioral analysis. Applied behavioral analysis is simply talking about the child's behavior. Applied behavioral analysis teaches new skills and applies these skills to new situations. Applied behavioral analysis discourages negative behavior and encourages positive behavior. The second treatment option is speech therapy. Some people with autism have deficits in social communication. Speech therapy is an important treatment option for these people. Speech therapy with a licensed speech language pathologist helps to improve a person's communication skills, allowing him or her to express their wants better. The third one, occupational therapy. Occupational therapy is often used as a treatment for sensory integrated issues associated with autism. It is also used to help teach life skills that involve fine motor movements such as dressing, using utensils, writing, etc. The fourth treatment option is physical therapy. Physical therapy is used to improve gross motor skills and sensory integration issues. Unlike occupational therapy, physical therapy works to improve skills such as walking, sitting, coordination, and balance. It is also important to note that physical therapy is most effective when integrated into an early intervention program. Then the last treatment option is medication. Pharmaceutical treatment can help reduce some of the symptoms of autism, such as irritability, self-injurious behavior, etc.
So in conclusion, as we join the World Health Organization to create awareness about autism, let us remember that an individual with autism is first and foremost an individual. Learning about the symptoms can help you begin to understand the behaviors and challenges related to autism, but that's not the same as getting to know the individual. Each person has their own strengths, likes and dislikes, interests, challenges, and skills, just like you do. So love, respect, and treat everyone fairly.